Hello dear friends, Assalamu alaikum and welcome back to top lesson for you dear friends. You know that we are discussing about the femur bone, right? The anatomy and the markings of the femur bone. In the previous lecture I have discussed about the upper end of the femur, right? I hope you have watched that lecture and you have learned about the upper parts of the femur. Now you can see on the whiteboard we have the theory of this upper part. Then we discussed it also practically, and we have applied this theory on this bone in a video, and I hope you have watched that. Now our lecture is about the shaft of the femur, so we are going to discuss in this lecture about the shaft or the middle part of the femur. So let's begin our lecture. Okay, so friends, welcome back. My dear friends, let's first of all introduce the shaft of the femur. So the shaft of the femur is the middle part. It is in between the upper end and the lower end, right? And it is also known as, you know that while I had discussed about the anatomy of long bone, this is called the diaphysis, right? So if you see the diaphysis of the femur, for example, this is the left femur, right? You can see it in the camera. Now let me position it in its anatomical position, in real anatomical position. So I had told you that the head of the femur should be directing medially. Let me show you here. Yes, we have this pelvic bone. So look carefully. This is your pelvis, right? And this is the femur bone. So it should be like this. The head should be upward, medially, and a little bit forward, right? Then the shaft will be in this position. Now let me explain this position to you guys. Its upper end is a little laterally on both sides, but the lower end is little medial to the medial side of the body. They are like this, right? In our body they are like this. It is because of the broadness of the hip bone or the pelvic bone, right? So they are located in this position. So we say that the upper end is a little wider, is a little to the lateral sides, but the lower end is little medially on both sides. That's why our feet are like, okay, let me show you. Our feet are like this, right? Like this. So then the next thing about the shaft is that interiorly the shaft is little bit convex and posteriorly the shaft is little bit concave in its position, right? As you can see here, interiorly it is a little bit forward, right? So we say interiorly it is convex, but posteriorly it is a little bit concave. So let us go forward and see some other points relating to it. So we are discussing about the shaft of the femur. So my dear friends, we divide the books and the anatomists divide the shaft of the femur into three regions. Now from here above, right, this is the upper 1/3. Now we will discuss the features in this upper 1/3. Then there is the middle 1/3, right? There is the middle 1/3. So we will discuss the features in the middle 1/3, and then there is the lower 1/3. Then we will discuss the features in the lower 1/3 of the femur. That will be the end of the shaft of the femur, right? So let us discuss about the upper 1/3. Actually, we say that the shaft of the femur is divided into three parts, right? It is divided into three parts. There should be, the first one should be upper 1/3, upper 1/3. Now we discuss the features of upper 1/3. First of all, my dear friends, about upper 1/3 of the femur is that this has four borders and four surfaces. It has actually borders, right? And then it has surfaces and some other markings I will discuss, right? How many borders? There are four borders. And how many surfaces? There are 4 surfaces. So 4 borders and 4 surfaces. And what are those borders? First of all, we should know about the borders. Then I will show you in this bone practically, right? Don't worry, guys. First of all, let me write the theory. Then we will go towards the bone. So there is the medial border, right? Then we have the lateral border, right? Then there is the spiral line, I will show you, right? And then there is the lateral lip of the glucial tuberosity, lateral lip of glucial tuberosity. Done. So how many borders it has? It has 4 borders. The medial border, the lateral border, the spiral line, and the lateral lip of the glucial tuberosity. Now look carefully how many surfaces it has. It has 4 surfaces. So let me show you here, my dear friends. This is the right femur, right? And we are discussing about this upper 1/3. Let me show you here. This is the left femur. We are discussing about this upper 1/3. So the upper 1/3 has a medial border, right? It has a medial border. Then it has a lateral border, right? Then if we look posteriorly, 2 lines join together and make linea aspera, right? I will show that later, and I can see it in this book clearly in this model, right? So look, let me show you with this blue color. Okay, look carefully. This is the left femur bone, right? Here is a medial border. Then here is a lateral border, right, my dear friends? And if you look at the posterior aspects of this bone, there is the lateral lip of glucial tuberosity, right? And then there is the spiral line, right? So the spiral line makes a border, the lateral lip of glucial tuberosity, then there is the lateral border, and then there is the medial border. So the upper end of the shaft of femur bone, or the upper 1/3 of the shaft of the femur bone, has how many borders? 4 borders. Medial border, lateral border, spiral line, and the lateral lip of the glucial tuberosity. Then my dear friends, it has 4 surfaces. Look, there is anterior surface, I will show you. There is the medial surface. So if there is an interior surface, there is a medial surface, right? Then there is the lateral surface, and then there is the posterior surface. Right? So how many surfaces? It has 4 surfaces. Let's see it here. Look, this is the anterior surface, right? This is the medial surface, right? And then there is the lateral surface. Then there is the posterior surface, right? So how many surfaces? 4. Posterior, anterior, medial, and lateral surface. The posterior surface of this femur bone, the posterior surface of the upper 1/3 of the femur bone has a rough area, and that rough area is called the glucial tuberosity. So this is called the glucial tuberosity. Now let me write it with the green color here, that the posterior surface has a very important marking that is called the glucial tuberosity. Right, friends? Okay, so what did we learn? We learned that the upper 1/3 of the femur, of the shaft of the femur bone, has borders and has surfaces. How many borders? 4 borders. There is medial border, lateral border, spiral line, lateral lip of the glucial tuberosity. Then it has 4 surfaces: the anterior surface, the medial surface, the lateral surface, and the posterior surface. And this posterior surface has a very important marking that is called the glucial tuberosity. Right friends, now let us see all these parts in a video and we apply this theory on the bone. Right.